Hi, my name is Krish Patel. I'm a second year bioengineering student at UC Berkeley. This is
Hi, I'm Carla Gutierrez. I'm also second year studying bioengineering. This is a presentation on electrosurgery.
so a little bit of background regarding electrosurgery. Electrosurgery involves the use of a high frequency electric current to remove tissue, coagulate bleeding, destroy tumors, amongst other applications. Now, this happens through the use of an active and dispersive electrode, where the temperature of the tissue is elevated for cutting, coagulation, desiccation, and fulguration. Now, why do we use electrosurgery? Because it's rapid, efficient, and relatively affordable. Some other advantages of the procedure is that, in addition to it being faster than excision and incision procedures, the equipment is extremely simple to set up, which also helps, shorten the procedure than most handheld surgeries. Electrosurgery also enables the extreme control of bleeding, and this is also very quick. ES results are immediate, and this provides practitioners the opportunity to control the extent of the treatment, how far they actually want to go in treating the patient. Now, electrosurgery is also extremely reliable, involves low maintenance instruments and inexpensive equipment. Some disadvantage to electrosurgery, however, is that it's easy to mistreat or overtreat just because of its new technology and it being a new sort of procedure. Beginner surgeons also may incorrectly channel electrical energy down vessels and nerves and damage them if used incorrectly. In addition, an excessive application of electrical energy can also increase the risk of hypertrophic scars. Patients can also experience burns due to the presence of a current, and possible defects or detachment errors may cause damage to actual body tissue.
So two of the circuits that are included in electrosurgery are monopolar and bipolar. Monopolar circuits contain a high frequency electrical generator and two electrodes as seen to the figure to the right. This delivers a high frequency current from the active electrode through the patient's body and lastly to the return electrode where the current flows back to the generator. The tissue is resistant to the alternating current pathway, which is how it converts the energy to heat, resulting in the thermal tissue damage. The monopolar electrodes are more effective in accomplishing hemostasis, sealing more blood vessels and resulting in a more complete coagulation. Bipolar circuits, on the other hand, only have two electrodes, as seen to the figure to the right, where the current is only limited to the tissue between the two electrodes. One electrode produces the current while the other acts as a sink to draw the current back to the generator. These circuits require a low power and a localization of current, which results in the reduction in tissue damage. One of the procedures within electrosurgery is electrosection, which is when an electrical current in a continuous, pure, uniform sine wave appearance is applied at a high frequency through an electrical surgical tip, which results in electrosection, which is similar to cutting. This is similar to any surgical steel incision, except a small amount of heat-induced tissue damage is caused, but it does allow for rapid healing during the post-op process. Within electrosection, there is pure cutting and blend cutting. Pure cutting is the use of the continuous current and a thin electrode to achieve precise cutting. A low power setting is used to increase the tissue temperature. When it reaches above the boiling point, though, it does cause tissue fragmentation and cutting. And then the application has little coagulation on the incision walls and hemostasis. Blend cutting, on the other hand, is the use of interrupted current to surpass the boiling point of the tissue at a desired pace. And this does result in more coagulation on the incision walls than pure cutting.
Another procedure that we'll be discussing is electrocoagulation. Now, this occurs when an electrical current is applied in intermittent pulses that are also damped. Now, because of these intermittent pulses, the voltage immediately returns to zero after each pulse, which in turn delivers a strong initial burst each time the pulse is used. Now, this is useful for controlling bleeding, destroying vascular structures, and executing rapid hemostasis without cutting. Now, in electrocoagulation, either a fine tip or a large tip electrode can be used to achieve whichever desired result you may want or the surgeon may want. A fine tip needs a low power setting and is more suitable for superficial coagulation, causing the tissues to dry out, also known as desiccation. Once the current decreases, a popping sound can be heard and sparking may occur, which are some drawbacks. Now, the large tip, however, is suitable for deeper coagulation by decreasing the current density. The blended current has the combined characteristics of the continuous sine wave and the damped sine wave, resulting in both electrosection and electrocoagulation when applied to the tissue. Now, what this does is promote incisions with minimal blood loss. Another procedure is electrodesiccation. Now, this was mentioned before under electrocoagulation, is produced by damped oscillations. Now, this procedure requires the voltage and the current to vary in order for heat to be generated to desiccate and dry the tissue. It involves the use of minimal power to allow for the most damage to be confined only to the upper layers of the skin and permit only minimal scarring. If higher power settings are utilized, however, deeper tissues can be coagulated. However, you run the risk of potential and further scarring. The last procedure we'll be discussing is electrofulguration. Now, this uses the same electrical energy as the damped sine wave configuration. However, the greatest difference is that the electrode is positioned slightly above the surface of the skin. The spark produced carries the current to a specific point, resulting in a charring effect. The low power usage allows for the temperature at the end of each spark to be extremely high, leading to tissue fragmentation, which is useful for whichever procedure the surgeon may be wanting to use. If the electrode is kept over a particular area, however, the continuous heat produced on the superficial layers can cause heating of deeper layers, which may be a drawback.
So this image pretty much sums up the previous procedures and we stated, which was just kind of demonstrates how the electrodes are really positioned in the patient's body to actually cause any fragmentation of tissues. So current applications right now are within dentistry, which has actually been happening for over half a century. We specifically focus on restorative dentistry, which is electrosurgery is beneficial in cutting and coagulation. Specifically, monopolar modes are widely used due to the variety of electrode shapes available, as it reduces the restrictions of any use and is more precise in microsurgical procedures, as seen to the figure to the right. Any mostly pure sine waveforms are preferred in dentistry to cause tissue shrinkage, allowing for a clear view to the surgical site. Some damped waves are introduced for bleaching discolored teeth. The heat source, which is coming from the electrical surgery current, produces heat, which is utilized to release oxygen from a bleaching agent to remove any tough stains that are not able to get removed with just a simple bleaching agent. Lastly, we also have in general surgery, electrical surgery normally is used with the bipolar circuit, and it's utilized in sealing blood vessels, and it's an alternative to vascular staples or titanium clips. The operating time is significantly decreased as the vessel sealing is rapid, and if properly controlled, it can promote hemostasis. Head and neck surgeons have obtained favorable results when using bipolar electrosurgery, and this is because it reduces the incision length with minimum blood loss. And that concludes our presentation.